Hey, friends, welcome to episode 429 of Better Than Before Breast Cancer. I'm your host, Laura Lummer, the breast cancer recovery coach, and I am really excited to share today's episode with you because we have a very special guest today. Her name is Dr. Toni Engram, and she is a biological dentist. Biological dentistry is something I'd really never heard of until I started studying the integrative approach to health, the metabolic approach to health, the metabolic approach to cancer. It's something that I just never really heard mentioned, but it's a very integrative approach to dental health. And something that's so important about that we're going to hear today is like, what does this mean? How does dental health really impact our overall wellness in our body? What about the materials used in dentistry? What does biological dentistry even mean, and how is that different from regular dentistry? I get a lot of questions about this from my clients, so I am so excited to be able to ask these questions of Dr. Engram today. Let me tell you a little bit about her. She's a biological dentist and an integrative health coach. She's the owner of the Flourish Dental Boutique in Richardson, Texas. And after her own personal health struggles with autoimmune disease, Dr. Engram shifted her practice philosophy to focusing on whole body health and the prevention and safer treatment of oral disease. She has degrees from Texas Christian University and Baylor College of Dentistry. She's a member of the Academy of Oral Medicine and Toxicology, otherwise known as IAOMT. She's also a member of the International Academy for Biological Dentistry and Medicine. She is SMART certified in safe amalgam removal techniques and accredited through the IAOMT. And she is an ambassador through the Breathe Institute. She's also a certified integrative health coach through the Institute of Integrative Nutrition. So super smart lady. I cannot wait for you to hear her story and to hear how this practice can be such a wonderful thing for us to dig into and another opportunity to have the power to support our overall wellness. So without further ado, let me introduce you to Dr. Toni Engram. Welcome, Dr. Engram. So happy to have you on the show today. So much I could take up your whole afternoon because there's so much I want to learn from you. So we'll just dig right in. And I'd love first to just hear about you and your story and your journey and what led you to do what you're doing now.
It was definitely not my intention to do anything holistic or biological. I didn't know what biological dentistry was when I was in dental school. But thankfully, God had other plans. And, when I got out of dental school, I just hit the ground running and was working really hard. Was working full time as an associate dentist. I had a toddler at home, so I was a new mom, and I was opening my first practice from scratch. I was doing a scratch startup, and it was just too clearly it was too much for me because I got super sick. Started having all kinds of GI issues. Was in the bathroom like 10 to 20 times a day
My
sometimes,
gosh.
and it was not fun, and started, finally went to the doctor, and again, no holistic background at all. So I'm going to conventional doctors, went to a gastroenterologist, and he's like, okay, Toni, this is probably just some IBS, here, take some peppermint tea and call me in a few months. Well, I didn't get any better, and then I started losing weight, and I was not trying to lose weight, and started bleeding, having, bloody stools. So
Oh my gosh.
I went
That's
back.
not
I
good.
was like, hello, this
Yeah.
can't be good.
Yeah.
Um, and so did a colonoscopy, which is super fun, as a 30-year-old to do a colonoscopy,
Wow.
and found that I had Crohn's colitis, and was given, he was very kind. He was surprised at what he found, and he gave me a very Western medicine answer. Was, here are your list of medications that you're going to take until they stop working. Then we'll put you on
Mhm.
stronger meds. And oh, by the way, there's about a 40% chance you'll need surgery at some point to lose all or part of your colon. Um, and I was like, wait, I'm sorry, I don't have time for that.
Yeah.
I was like, you don't get it. Like, how do I get rid of this? How do I not have this anymore? What should I be eating or not eating? And he looked at me, he's like, "Toni, your diet has nothing to do with this."
Wow.
Really?
Nothing to do with your digestive tract. That's fascinating.
Exactly. Exactly.
Yeah.
Um, and, I'm in the South, so now I say bless his little heart. Um,
Good for you.
so I just didn't that answer did not sit right with me. So
Mhm.
I did take the medications, and I'm so, so fortunate because the medications did get me into remission really quickly. And
Awesome.
that really gave me the space that it bought me time to be able then to
Yes.
do my own homework and figure out how do I actually heal, because I don't believe what he's telling me, that this is my fate and this is a life sentence.
Yeah.
Um, and so thankfully I did find what worked for me. I pieced things together. I didn't know what functional medicine was, so I was just becoming my own doctor.
Mhm.
And I found diet practices that worked for me, a lifestyle that worked for me. I learned to listen to my body a whole lot more because I was not doing that. That was not the culture I was brought up in. I was brought up in, perform, 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 and ignore what your body's telling you so you can perform some more.
Yeah.
And that just didn't, my body said enough's enough. And so as I was going through that healing process, I just saw the correlations between what I was treating in my own body and what I help my patients with every single day. So,
Yeah.
Crohn's disease, it's an autoimmune condition, but it's all about inflammation. It's an inflammatory condition caused in large part by a dysbiosis, by this imbalance in the bacteria in the gut. Well, gosh,
Mhm.
what do I treat every day? I treat tooth decay and gum disease. It's all about inflammation and an imbalance in the very first part of your gut. So I
Yes.
knew that if I could figure out how to get myself well, that I had the ethical and the moral responsibility to figure out how to do the same thing for my patients.
Love it.
And so that's exactly what I did. I started feeling better. I finally, weaned myself off of all the medications. So I've been in remission. I would say I no longer have Crohn's disease and haven't for over a decade.
Awesome.
Um, and now that's what I help my patients do too, is we find the root causes for them. We get to the heart of the matter. We figure out where the imbalances are, and we
Mhm.
try to bring homeostasis back to their mouth so that they can absorb the nutrients that they're eating, so they can have healthy gum tissue, healthy bone structure, and healthy teeth.
Love it. A couple things you said that really stood out to me is one, do you think that a lot of people miss the connection that the mouth is the beginning of the digestive tract? Like they're not really, that doesn't sink into a lot of people, don't you think? And the microbiome in the mouth and how it impacts us.
Worse than that, I missed it myself as a dentist for years and years. Yes, it's unfortunate that we have separated these. We've intellectually separated the mouth from the rest of the body, but
Yeah.
you're 100% right. It's so intricately connected. Not only is it the first part of your digestive tract, but it's a direct entrance into your circulatory system, because all the mucosa that you have in your mouth, all the pink stuff, is so highly absorbent.
Mhm.
And it's a direct entrance into your respiratory system. It's
Mhm.
meant to be your backup entrance because you're supposed to be breathing through your nose. But when you can't, you get this direct entrance, God's natural backup system into your respiratory system. So it's just key to connecting all of these different systems within the body.
So good. And I have a background also in Ayurveda, and tongue diagnosis and looking in someone's mouth is just an important aspect of the overall, just a physical assessment of somebody. Do you have cracks in your tongue, coating, scalloped tongue? What does your mouth look like? And people, it's so funny when you look at someone's tongue and say, "Oh, are you feeling this? Are you feeling that?" And they think you're a fortune teller or something. And it's like, no, this is just a visual of what's happening inside your gut, right? So it's so
Yeah.
cool.
Yeah.
And I love the other thing you said, especially with, the my audience, which of course is primarily people who've had a cancer diagnosis, that sometimes, like, there is goodness to standard of care. That if you're going to the bathroom 20 times a day, you don't have time to figure out how to heal yourself. Sometimes it's that medicine, whether it's for our emotional, mental health or our physical health, that gives us enough space and comfort, freedom from pain and discomfort, so we can look into what can serve us and believe that we can start to support our body's own ability to heal. I love that. And it doesn't have to be a forever thing, right?
Right.
I think unlike what you shared, a lot of people think, "Oh God, once I start a med, that's it, I'm on it forever." And it doesn't have to be like that. It can be a really beneficial bridge. So I love your story. It's so beautiful that you believed in yourself, right? You trusted the intuition of the body, which is, I think, a critical factor in healing. So tell me what biological dentistry is. Like, what is the core difference between conventional dentistry and biological dentistry? And just like, what are the core principles there?
Yeah. So I'll start super high level and then I'll get down into like practically speaking what that actually means and put it in English. So, super high level, we're using the concepts from biological medicine, which is we're going beyond the germ theory of disease. And germ theory just says, one germ causes one illness. And so therefore one chemical, one thing can cure said illness, and it looks at the terrain theory of disease. So, what are we doing to protect and support the health of the terrain, which is the entire human body? How are we either contributing to health? And so, from a dental perspective, what am I doing in your mouth? What am I helping you do that supports the health of your entire body? Or what's going on in your mouth that might be contributing to disease and dysfunction elsewhere in the body. And so it's taking just this whole body approach to wellness in the mouth specifically. Um, Practically speaking, what that means is yes, it is whole body. So, very much holistic care. We focus on prevention and nutrition first, and then only if we need to intervene, then we intervene. And when we do, we're much more intentional with the products and the materials that we use. So I'm very concerned and cognizant of what's in my filling material, what's in the toothpaste that my hygienists are using, what's in the crown material, and is that contributing to a patient's health or is it not? Um, more nitty gritty things that you'll recognize is I don't have any fluoride in my practice at all. Um, those old silver fillings, it not only do we not have them and don't use them, but we are very, very specific with how we remove them, because removing them actually creates this pretty intense heavy metal exposure just from the removal process itself.
Really?
And so those are the things that you'll notice first and foremost, most likely.
Can you speak to, like, why is that important? Why? I mean, we've been told forever, use a fluoride toothpaste. We use whitening toothpaste. We use fluoride toothpaste. I mean, most people, I think, if, as kids, we have cavities, we've got silver fillings, right? And it became you could get the white ones because it looks prettier. You don't have the color. But how do those materials impact our health? And why would we not want to use them? And what materials do you use? How does it impact us?
Well, the silver fillings, I think, were an easier jump for my dear sweet colleagues, because it's those old silver fillings. They are literally 50% mercury and 50% silver, tin, and a whole bunch of other random metals, to make this gooey structure that starts out soft and then hardens once we place it in the teeth. And what we were taught in dental school is that once you mix the mercury with these other metals, that then it's chemically bound, which is true, it's chemically bound, but they would say that then the mercury vapor cannot escape. It is chemically changed, and so there is no risk of mercury exposure after the fact. Well, what
Okay.
we know now is that there actually is. And the half-life of mercury within a dental filling is 50 years.
Whoa.
50 years.
Whoa.
So those fillings that you got as a kid, you are still leaking just a little bit of mercury vapor every time heat or friction is applied to those teeth.
Wow.
So that means when you chew, when you brush your teeth, when you grind or clench your teeth at night, when you drink hot coffee, all of those things will create these little micro exposures. Well, what happens when dentist, a very well-meaning dentist, wants to remove them, and we take a high-speed dental drill at 800,000 RPMs to that tooth, you're going to get this huge exposure. And so we want to make sure that when we do those types of procedures, that we are protecting you, the patient, that we're protecting ourselves, and we're protecting our assistants who are in the room from that mercury exposure.
Mm.
Um, so thankfully, we haven't been able to get as many of our colleagues to recognize the risk from removing these as much as we want, but at least they're phasing out. And I have very few colleagues who are still placing those fillings. Um,
Really?
and the FDA has helped with this some, and that they finally said that, hey, these mercury fillings are probably not the best option for pregnant women and children,
Mm.
um, or anyone sensitive to them, which, and I would say is 100% of people would be sensitive to
Yeah.
mercury exposure.
Yeah. Yeah, for
Uh,
sure. And the other
now,
metals, right? That are in
and
there
the
as well.
yeah, not to mention the other metals for sure.
Yeah. Yeah.
Now fluoride, on the topic of fluoride, that I think is a tougher sell for dentists and the American Dental Association. It seems like we're just so entrenched in our education that said that this was the greatest public health advancement of the 20th century. The CDC still says that water fluoridation is the greatest health advance.
Yeah.
Um, what what I've noticed lately, and by lately I mean the last 10 years or so, is that we were a bit oversold on the benefits of fluoride.
Okay.
So, yes, tooth decay did decrease when we started adding fluoride to our water a half a century ago, but it also decreased in other parts of the world where they did not add fluoride to the water,
Interesting.
right? So,
Yeah.
so tooth decay decreased everywhere, and the factors that went into that are many. So yes, it's lifestyle. It is, increase of toothbrushing. It's a lot of things that it's better access to food. So
Mm.
slightly better diets, even though it's still pretty scary out there diet wise. Um, so all of these things contributed to a lower rate of tooth decay. So we can't necessarily give all the credit to fluoride.
Okay.
At the same time, more and more studies have come out recently that are linking higher levels of fluoride with other health effects. So the most notable, and I think the most um, angering, honestly, is the decrease in IQ of our children. Um,
Really?
those who are exposed to more levels of fluoride have a lower IQ, which is terrifying. As a mom, it just makes me absolutely furious.
Yeah.
Um, and the issue with that when it comes to fluoride in our water is that we cannot control the dose. You can't
Mm.
control the dose when fluoride's in the water.
Mm.
So we don't actually know. I mean, if you think about it, you've got let's say a 70-year-old, 200-pound man who drinks 1 glass of tap water a day.
Mhm.
And then you've got a 15-pound infant
Mhm.
whose mom is feeding them formula mixed with tap water.
Oh, yeah.
So the dose of fluoride per kilogram of body weight is going to be vastly different in those two scenarios.
Right.
And it's really difficult to tell, how much fluoride is each person absorbing and how much is getting passed through. So because we cannot control the dose, we really don't know yet what level of fluoride in our water is safe and what level is not.
Mm.
And that is the issue that we have. So if we were to, go hopefully 10 years in the future and none of our water is fluoridated anymore, which I'm hopeful for, honestly.
Right. Right.
Um, then I might feel better about my patients using fluoride in a toothpaste,
Mhm.
or, if our products in the dental office have a little bit of fluoride in it, because then we
Mhm.
know the dose. We know the dose and we can control it, and we know what level is harmful for certain people and what level is completely safe. But until then, we don't know what that level is. And
Yeah.
so I'm no longer willing to use fluoride or to recommend it or to even have it in my practice. So we
Okay.
filter it out of our water as soon as it comes in. We are constantly calling out our dental materials because we actually have to call in dental supplies. It's, fluoride isn't on the label like it is for consumer products. So we actually have to
Oh,
call manufacturers and say, okay, does this cement have any fluoride in it? Does this whitening gel have any
really?
fluoride in it? Because it's not necessarily on the label.
Oh,
Um, and so it's a process until we know exactly what dose is safe, what dose is not safe, and we can control that dose. Then we've just planted our flag in the ground that we're not going to have it.
yeah. Do you recommend for your patients that they get some kind of water filtration system that does remove fluoride in their homes? Yeah.
I do. Yeah.
Mhm. Yeah, to look for that. So I think that's an important thing about water filters. A lot of people just think get a water filter, but isn't it kind of important to understand what's in your tap water to get filters that you know can filter those specific things out of your tap water, right?
And fluoride is one of those things that's a super, super tiny particle. So it really needs to be reverse osmosis filtration in order to get it out. You're not going to do it
Okay.
with a Brita filter, with any kind of charcoal filter. It's not going to do it. And
Interesting.
so I do like reverse osmosis for that. And thankfully, if you are using a reverse osmosis filter, then it's going to also filter out some of those chemical, like pharmaceutical contaminants that can be in the water supply too.
So what do you say? So you said earlier that you do the exam and you said, if I need to intervene, then we intervene in this careful way, but we're looking at the whole system. What does that mean? Can you expand on what you're looking for and what that means?
I firmly believe that most of the time, less dentistry is the best dentistry. So if I can catch something early, or better yet, if I can catch people who are just showing initial signs of imbalance, like maybe the pH of their saliva is a little acidic, or maybe we see a saliva test and they've got a couple of pathogens, um, or even more advanced, and we're seeing clinical signs like just the beginning signs of a cavity or a little bit of gingivitis here and there. Um, the ideal is for us to be able to make tweaks to what you are doing at home. So tweaks to your diet. Are you taking in enough of the right nutrients? Asking about your gut health. Are you absorbing the nutrients that you're taking in
Mhm,
adequately?
mhm.
And being able to make those little shifts so that your body has what it needs to heal on its own. Because
Okay,
I firmly believe that your bodies are meant to heal. All of us, our bodies are meant to heal and to be well. And we just need to make sure that they have what they need to do so. So that's always the goal, is we start with nutrition prevention, and we start with things that don't involve drilling or cutting, if at all possible.
Wow. Is it possible for, so if you see the beginning of a cavity, can a body stop or reverse a cavity once it started?
Sure can.
Really?
Absolutely.
Never
Yes.
heard that.
Yes.
Amazing.
And any dentist who doesn't say that did not pay attention in school. So this is something like even the mainstream, like even in dental school, we were taught that a cavity, what we call an incipient lesion, it just means a very, very small cavity within the enamel, within that outer layer of tooth structure, still has the ability to remineralize and heal. And so that's what we want to do is we want to help the enamel remineralize. Um,
Mhm.
Now, what they also tell us is once it gets past the enamel into that second layer of tooth structure called the dentin, then in dental school, they told us that at that point, it's not possible to remineralize things and get the lesion to heal.
Okay.
I would say I leave space for miracles all the time. And so it is possible to get it to heal, but it's much harder. And once it's in into the dentin, into that second layer of tooth structure, then we are typically talking about some kind of restoration, either a filling or whatever the case may be.
Okay. Can you speak to, so when you have a cancer diagnosis, is there something that you know, because also as the integrative health coach that you are, how the microbiome in the mouth obviously is going to be affected by the treatments we go through, chemotherapy, radiation, and the drugs, the aromatase inhibitors, SERMs, all of that kind of stuff. How does it impact us? And I know that from my clients, a lot of people, when they get a diagnosis, they get scared and they think, oh my God, I got to get all these metal fillings out of my mouth. Then they get scared because they hear, as you mentioned a minute ago, well, that can create a big toxic burden. So, and also, as we spoke just before we started this podcast, was some of the medications like Zometa, we're told you must be off this for 3 months before you do any kind of drilling of any kind because you could get jaw necrosis. And then that is a medication that I take. So it's really scary because I think, well, is 3 months the minimum safe distance? Should I be off for 6 months? How do I know? So I think a lot of people who are already fearful of dentistry will either shy more away from it or who are fearful of the burden of metals might jump in and do dental procedures at a time when maybe it's not an ideal time. So, can you speak to all of that? Like, how do we know what's safe, how it's impacting us, and how we can support ourselves in the best way?
That's when I think it's just really, really important that your providers are all working together because all of these concerns are valid. And a lot of times it's just a matter of timing things correctly. We don't want to give your body too much to have to work on at once. And so being smart and being intentional with the timing, I think is really key. And so if we can get, the oncologist, the integrative physician, the primary care, the dentist, if we can get everybody talking and collaborating on, okay, it makes sense to do this at this point of treatment or before this treatment, but not before this one. Um,
Okay.
then it really can be a collaborative effort to where we can get it all done. But I agree. And when patients come into my practice and they've had a diagnosis like that, like some kind of cancer diagnosis, then they want to do it all at once, but they're scared. And so it's really hard to know what makes sense when, and we just have to all get on the same page because it's different for every patient. Sometimes it makes sense to do dental work first, and sometimes it doesn't.
Are most standard of care oncologists open to that discussion with you? Is it easy to kind of get on the team and work with them?
I've been pleasantly surprised.
Okay.
Most oncologists have been more than willing to have a conversation. Now I let them and the patient lead the way on that.
Mm-hmm.
Um, Not because I don't wanna step on toes, but because I feel like they're the more urgent health issue going on, and my job is just to support. My
Hmm.
job is to only do things in the mouth that are going to support them healing and support whatever they're doing with the oncologist, and not add to the burden that their body is already having to deal with.
Uh,
And so they are always more than willing to speak with me, although they have said the only thing that I've been surprised, and I shouldn't be surprised with, is some have said, when we're doing treatment, if we're doing something surgical, then I will usually have my patients do IV vitamin therapy as, at the end of their treatment. And I've had
mm,
some oncologists tell me no, that they
okay.
don't want any kind of IV vitamin C with their dental
Mhm.
appointment.
Yeah, because they're not sure how that interacts with their chemo or if they should be
Right.
having antioxidant, right? If cancer uses it. Yeah.
Right.
So, when are there things that if we're in active treatment of some kind, are there things we can be doing to support and like safeguard ourselves? Are there mouth rinses or something we should be aware of that would be a great idea for regular practice in addition to brushing and flossing?
Absolutely. And I would say if you're beginning any kind of treatment, go ahead and just right now, before you even start, ditch any kind of mouthwash that has alcohol in it.
Okay.
Um, I would say let's get really, really simple and clean and supportive with anything that you're going to use in your mouth. And so for a lot of people, that might mean just good old salt water.
Okay.
Water and sea salt can be a really soothing rinse and can kill enough bacteria, can, help the gum tissue, and that can be all we need. Now, if we are in the middle of some treatment and you're having side effects that are impacting the mouth or impacting the oral mucosa where things are inflamed, um, or we'll have, gum tissue that's sloughing off here and there, it can be uncomfortable, it can be painful sometimes. Then we've got other things that we can use. Um, as we can compound prescription mouthwashes. I've got a homeopathic mouth rinse that's really good that
Okay.
was designed for specifically for people with dry mouth and people going through chemo and radiation.
Mhm.
And so we've got tools in our tool belt if side effects are causing the mouth not to feel well. But otherwise, I would say let's just get really, really simple because we want to support the microbiome and create as little damage as possible so that once you're done with treatment, then we can replenish things back with good nutrients, with oral probiotics, and we can reestablish balance.
Great. So for people who might be interested in having fillings replaced or getting some kind of procedure, can you speak to like what is smart amalgam removal? What does that mean? What are the safeguards there?
Yeah. So SMART is just an acronym for Safe Mercury Amalgam Removal Technique. And it was created by a group with another really long name. It's the IAOMT. That's the International Academy of Oral Medicine and Toxicology. And they developed these protocols to minimize any kind of mercury exposure during the removal of amalgam fillings because they found, they discovered these plumes of mercury vapor that we were all being exposed to in the dental operatory room when you were having amalgam fillings replaced. And so it really just creates these layers of protection for the procedure itself.
Mhm.
So we use tools that isolate the tooth that we're working on, these dental barriers called dental dams that really create a seal around the tooth. We use special suction devices, air filtration that can filter out the mercury vapor and also, pulls it away from us, away from the three people in the room as we're working. Um,
Mhm.
Everybody in the room is covered typically from head to toe. So, our
Wow.
hair is covered. We're all geared up, the patient and the staff, to make sure that anything we're exposed to is either filtered or we're covered and protected from it as best as possible.
Wow. It's like a hazmat situation.
It
That's a big
does.
deal.
And
Yeah.
it's funny. That was the hardest thing I think for me to take the leap and do as I transitioned my practice to a holistic practice. I was like, man, is this gonna our patients gonna be so scared of the way our gear looks
Yeah.
during these appointments? But I found that, once I explain that this is for everybody's safety and I'm not going to compromise my own safety or my assistant's safety, I'm not going to
Right.
compromise yours either. Then everybody is more than happy to wear the hazmat looking suit
Yeah.
for a
Yeah.
period of time.
Sure. Yeah. I mean, I wouldn't want to poison other people, with
Right.
my mercury if that was the situation. Yeah.
Right.
So, what do you think is, I want two things. I want to know about what are misconceptions? So when we talk about integrative care in the spectrum of health or people who are going through cancer treatment, there's all kinds of misconceptions and myths and all of that type of belief systems. Do you find the same thing in the biological dentistry versus conventional? And if so, what is that? What would you like to clear the air about?
Man, I think the first thing that I try to remind myself of every day, and I also try to remind my colleagues, and I try to remind my patients, is that healthcare and medicine, it takes a lot of humility to understand that we don't know what we don't know. And the things that we are so sure of right now, we may find to be not true later. And that's
Mhm.
okay. And we don't know everything.
Yeah,
So I think
that's a
that's
good point.
where we have to start. Um, but I would say right now, I get misconceptions on both sides. So a huge misconception from my colleagues is that biological dentistry is not based in science, and that's completely false.
Okay.
Completely false. So it is evidence based. It is science based, and it really takes a ton of study to be able to have the courage to say, oh, maybe what my colleagues believe or have been telling me my entire career isn't quite right or isn't
Yeah.
the whole story. Um, and then on the other side, I get all kinds of misconceptions from people who are already really, really holistically minded. Um, call them my super crunchy crowd, like
Mhm.
crunchy granola.
Yeah.
Um, I think sometimes they expect us to work miracles um, with neglect, and that's not possible either. So
Mhm.
you can't you can't have it both ways. And I really appreciate a more integrative approach where, yes, we have a lot of wonderful modern tools and techniques and methods. And I'm so thankful for them. Like you said earlier, I'm thankful for medications that we have. I'm thankful for dental materials that we have.
Yeah.
Even, back in the day, those amalgam fillings, they served a purpose for a time. And so for that reason, I'm grateful for that because it served a purpose for a period of time. But now our world is a bit toxic. Our exposures are a bit too toxic to be able to use that safely and ethically anymore. Um, so I just
Yeah.
think it takes balance. And that's what I'm always seeking to do is to have some balance to use the tools that God gave me, to use the tools that God gave us that we
Mhm.
created that are man-made,
Yeah.
and to know when I don't know everything.
I love that. Yeah. Is there, so most people, well, most women are diagnosed with breast cancer after menopause, right? In the mid 50s is the average diagnosis. Unfortunately, that's getting younger and younger. But then even after the diagnosis, the medications we are put on, or if we go through chemotherapy, we're put into chemically induced menopause. Does being in menopause level up the kind of care you need for your teeth in the same way that it impacts our bones, right? Internally, we don't see, we get told all about osteopenia, osteoporosis. Does that affect our teeth also?
I love that you said level up. Um, So yeah, in some ways it levels up, but not necessarily for everybody. I think like everything, these changes in life create shifts. And so for
Mhm.
some people, the shift is really positive. And for some people, the shift means, okay, now it's bringing to light things in our bodies that need more care, or things that maybe we were able to get away with neglecting that now we can't.
Yeah.
And
Oh,
so,
to be young and be able to be neglectful.
right, right. Oh, so our hormones and how they change plays a huge role in the health of our mouths.
Okay.
And it's different for every person. But yes, as our estrogen declines, as our progesterone declines, then we'll have less saliva. We're more prone to having inflammation in the gum tissue. And just those two things, a dried out mouth that's a little more inflamed, that in itself can create this whole icky, nasty cycle of either tooth decay or gum disease or both that we
Mhm.
need to pay attention to. Um,
Wow.
and then sometimes that's not the case. Sometimes I can see when I look in your mouth that things are out of balance, but it's not an oral origin. It
Mm.
is, hey, your hormones are just out of whack.
Wow. And
We
you could tell that from looking in someone's mouth at times.
Yeah, yeah. Oh, yeah. Because you get like it I can tell when an imbalance in your mouth is plaque induced or is there actual oral disease present? Is there gum disease? Is there tooth decay? Or is there not? Was this a lack of brushing and flossing, or was it not? Or do you just really need to see your functional medicine provider?
Mhm.
Is it time to get some hormone testing? And maybe it's time to do some bioidentical hormones. So it really is just so dependent on each person. And some of us fly through these hormonal changes, and all of the changes are wonderful and advantageous. And sometimes it's like a knock on the door, like, hello, you've been ignoring me for too long, and now you can't.
Yeah. So I've got to ask the question that I know everyone's thinking. How much does this cost, right? When it comes to integrative care or something outside the conventional world, is it covered by insurance? What do people do? How do people manage it financially?
Yeah. So this is something that's really important to me, and I don't have a solve for it yet. Um, but I'm working on it. I would say that the way that I feel I must practice, it doesn't allow me to be in a contract with an insurance company. So I'll use them. We file insurance claims all the time. I just can't be contractually obligated to their rules, their fee schedules, because I wouldn't be able to sustain that.
Mhm.
Because I've done that before and it was not
Yeah.
sustainable.
Yeah. Yeah.
And so we're what's called out of network with all the insurance companies, but we still file claims. Um, as far as the cost, my goal is that if you work for us and work with us and we're doing our job as providers, then you're going to spend less on dental care over the course of
Mhm.
your life. That is my goal.
Mhm.
Um, we also have, all kinds of easy financing and membership programs.
Oh, great.
I'm really, really excited about the free dental care that we do. We do a program that I call First Fruits Fridays, where we take applications to perform free dental care for people.
Oh, that's
Um,
awesome.
so I am access to care is something that I'm really, really passionate about, and I haven't solved it yet, but I'm working on it. And if your audience has more ideas, please send them my way.
Oh, that's awesome. Yeah. I mean, it's a tough thing, right? Because I mean, good care, it's everything's costly. Good materials are costly. Good people that are trained in these practices are costly, right? So it
Yes.
does make sense. And I think a lot of times, I think we have to begin to really open our mind to be outside of the conventional what does it cost and what does insurance cover, and kind of open ourselves up a little more to what other opportunities exist there. And I love what you said. It's like at the end of the day, we may be spending less if we're having the proper kind of care, right?
Yeah. Yeah.
Yeah. What would you say? Because I have to let you go, or I could ask you a million other questions. Because when you talk about dry mouth, I start thinking about sleep apnea and how's that affecting
Yes.
people. There's so many things that
Or
can
root
impact.
canals. I get a ton of questions about root canals and
Yeah.
cancer
Real quick, what are
diagnosis.
your
Yeah.
thoughts on root canals? Is there a need for root canals? Are they as dangerous as some people are concerned they are? What's the deal with root canals?
What's interesting is that we don't completely know yet. What we know is that when you have a root canal, it changes the microbiome in the area. And so you will get an immune response because everything has shifted. The tooth no longer has a blood supply. And so blood is what brings oxygen to the area. When you don't have oxygen, all of the normal beneficial bacteria that are oxygen loving, these aerobic bacteria, can no longer survive. And so it
Mm.
becomes the anaerobic bacteria that then take over. And they
Oh,
can kind of be like the bottom feeder, the the bottom of the ocean floor dweller kind of
yeah,
bacteria, the creepy crawlies. And
yeah.
so they will create a different immune response and sometimes an inflammatory response. And so I think there's a valid concern, especially if you've got a root canal and you notice health issues on that same side of the body. Um,
Mm.
and so science doesn't allow us to directly connect the two.
Yeah.
Not saying that that won't happen at some point, but I think it's enough to be concerned. And it's enough that many of my patients are concerned. And so we will do some elective procedures where they will ask to have teeth removed that have had root canals if they are concerned about certain health impacts.
Mm-hmm. Interesting. Yeah. Okay. We're going to have you back on to talk about more of this stuff and sleep apnea and all that. But I'd love to know from you what top three dental oral health, let's just not just say dental because I think we only think of teeth, but let's think of our whole mouths, right?
Yeah.
Oral health practices that you would say everybody really should be doing this.
Oh, it's, I mean, top three is
We know brushing is one, right? Is it
we
one?
know brushing. Yeah, but
Okay.
so let's not even talk about that.
Yeah. Let's not do that.
I would say a nutrient dense diet
Okay.
is number one. Um, Oral hygiene. We'll put all of that together,
Okay.
cleaning your teeth and using something to clean in between your teeth. I think that's two. And then I think if I heard correctly, you're going to like the last one, but I think tongue scraping
Oh,
is a
really? Okay.
fantastic practice. Yeah.
Could you speak? I think a lot of people probably don't even have never heard of tongue scraping. You want to talk about it for a sec?
Well, you were talking about it as an Ayurvedic practice, and so it's
Mm-hmm.
been used for thousands of years
Yep.
in Ayurveda as a way to rid the body of toxins. Well, clinically speaking, from a Western medicine standpoint, what we want to do is we want to thin out the biofilm in the mouth. And so your tongue has all of these nooks and crannies. It's super bumpy. So there are just tons of places for bacteria to hide and for a biofilm, which is like a whole city ecosystem of bacteria to form. And it gets thicker and thicker if we don't thin it out, if we don't
Mm,
disrupt the biofilm. And so if you've ever used a tongue scraper, you know that it works way better than just taking a toothbrush to your tongue.
yeah.
So I love tongue scraping as a practice.
Okay. Awesome. Yeah. So for anybody listening and you stick out your tongue and you see this big, thick white coating, that's a whole forest happening right there, right? Yeah.
Yes.
Get it, cut
Yes.
that forest down, get a tongue scraper. Yeah. That's awesome. Is there anything that I haven't asked you about that you think people should be aware of when it comes to biological dentistry?
Mm. I mean, things that we could talk about for forever. I would say the most important thing is just knowing that your body is designed to heal. It's
Mm,
how we were built.
I love that. I love that. And I love that whole team approach. I just think that's so important to have to realize that I think even though science has really siloed everything, right? It's moved more into everyone's a specialist on something, which has taken us completely away from the fact that the body works together and the mouth is part of the body and the digestive tract. So I love that whole team approach to wellness, especially for someone who's in treatment or trying to heal from disease. I think that's awesome. So I'm going to put a link. So you've got a great social media. I was checking out your Instagram. There's so much people can learn about you there and the links to your practice. Is there any like what's the best way for people to get a hold of you? Should they go to your website? Should they call the office? Travel to Texas so you can get some good biological dental care?
We are happy to have you in Texas. We will roll out the red carpet for you. Um, you're right. Probably our most of my educational stuff is on Instagram and on different social media channels. So at Dr. Toni Engram is where you can find me there. Our website, if you want to learn about the practice itself, that's www.flourish.dental. And we're right outside of the Dallas area. Like I said, we're happy to. We have a lot of patients who live far. They may want to fly in for specific things. You know, if their root canals are a concern, if their amalgam fillings are a concern, and they'll come to us and just address the big stuff.
Yeah.
And then we'll treat you like family for a few days and then send you back home to your regular dentist. So we're happy to do that too if you're not close.
Love that. That's awesome. That's great to know. Well, thank you so much. We're going to have you on for a continuation because, yes, there's just so much that is
Do
so
it.
fascinating about this. But it's absolute pleasure. Thank you so much for coming on the show and sharing all those insights with us.
Oh, thank you so much. I appreciate it.